So how do we manage flat foot? There are lots of options. We can treat them by rest, specifically in coalitions. Insoles is another option. Physiotherapy. We can do surgery, or we do not treat them at all. So how do you decide what is to be done in which patient? Let us talk about it. So less than 6 years of age, whether we should give shoes or we allow barefoot walking, I think it is still a bit controversial. But one school of thought says that those children who walk barefoot, they have a better proprioception of their feet, especially the plantar surface, and they have a strong intrinsic musculature. So that would help the patients in developing the arch. Again, there are some studies which says that if the child wears shoes a lot of times during their early childhood, they are slightly more prone to develop flat foot, or maybe that they have a less chance of their flat foot to get autocorrected by itself. Well, if you see a coalition and a patient has something like a peroneal spastic flat foot due to the inflammation of the lateral aspect, rest in the form of cast may be needed for a short period of time. Physiotherapy, yes, I think it plays a very important role in relieving the symptoms. So when we talk about relieving the symptoms, it has been known that gastrocnemius contracture or tight Achilles tendon along with flat foot would lead to worsening of the symptoms of flat foot deformity. So stretching of triceps surae or stretching of gastrocnemius is something that is helpful. Similarly, we can stretch the lateral muscle or the peroneal as well. Apart from that, strengthening exercises can be done, which does not just strengthen the tibialis posterior, flexor hallucis longus to counteract the valgus, but also the intrinsic musculature and abductor hallucis to prevent the flattening of the arch. But whether does it lead to improvement in deformity, either in pediatric or in adult flat foot? I think the answer, we don't really have it. We don't have a conclusive evidence that yes, they help in improvement of deformity. There have been anecdotal studies which really talk about it. So this is one of the article which was published in 2016 for a group of university students in Korea, and it says that yes, applying short foot exercises for pes planus, it helps. So next is the management using insoles. Yes, insole is one of the most commonly prescribed thing for flat foot patients. So when we are managing the patient with the insole, we need to know that first of all, we always prescribe medial arch support, but it is not just the medial arch support. It is also the medial heel wedge in these patients. So do not forget the medial heel wedge. Second thing, please get the patient's insoles to be customized. It has to be customized as per the feet, as per the deformity that the feet has. You cannot give the patients the usual non-customized insole just by purchasing it online or through a shop. Insoles do help the patients in symptomatic relief. They relieve the symptoms, they offload the arch, but they are not the cure. Remember, insoles does not correct the deformity. The deformity does not get corrected with insoles. So talking about surgery, what are the surgical options that we have? So we can do soft tissue surgery, we can do bony surgery, or we can do what we call as arthrodrisis. It is not a bony surgery, but it is an insertion of a stent in the sinus tarsi region.